This is Kirathimo Muruga, student at Risaba University, presenting a paper entitled Effect of COVID-19 Pandemic on Health System, presented at 38th IBIMA conference in November 2021. The agenda of this presentation is number 1, the purpose of the research, number 2, background of the study, number 3, problem statement, number 4, literature review, number 5, methodology, 6, result, number 7, discussion and conclusion, lastly, number 8, recommendation. The purpose of this research is to investigate the effect of COVID-19 pandemic on health systems and its management in Kenya. Background of the study. The 2019 novel outbreak of coronavirus disease, known as COVID-19, emerged in 2019 from Wuhan City in China and has now spread exponentially from more than one continent and is on a global scale. On 30th January 2020, the World Health Organization declared COVID-19 outbreak as a public health emergency of international significance. Because of its rapid and fatal health effects, WHO estimated COVID-19 fatality rate at around 2%. The tricky part of COVID virus is that the symptoms of the infection may appear in as few as 2 days and as long as 14 days, ranging from 2 to 10 days, 2 to 14 days, and 10 to 14 days, during which the virus is contagious, but the patient may not display any symptom. WHO scaled up strategic objective to respond to the spread of COVID-19 by interrupting human-to-human transmission through 1. Reducing secondary infection among close contacts and healthcare workers. 2. Preventing transmission amplification event. 3. Preventing further international spread. And 4. Identifying, isolating, and caring for patients early, including providing optimized care for infected patients. All these measures have forced world population to quarantine, do physical social distancing, and countries that are severely hit with COVID-19 infection have been forced to partially or totally lock down. The social distancing, quarantine, and lockdown proved to be one of the world's most psychological and economic experience, where most established and developing economies were put to the ultimate test. Sustaining the citizens economic-wise and health-wise in the lockdowns proved to be even harder. In treating the COVID-19 pandemic, the world was scrambling to build enough tents to treat those infected with the contagious virus. Epidemic, the size of COVID-19, have had huge economic and health impact, not just from the cost of managing the health of people, but stopping them and keeping the economy working. A steep fall in global stock market since it became clear that COVID-19 would not be limited to China alone, boldly highlighted the need for a vaccine, taking into consideration that there was no vaccine yet for the virus. Together with health professionals, financial sector played a full role in educating political leaders on the crucial decisions and considering the economic and health implications. They also had to guarantee sufficient support for response to public health. Measures that could make significant change in the effectiveness of containment approaches, such as improving tracking and ensuring the availability and accessibility of test kits and protective gear for the frontline health workers, must not fail due to lack of resources. COVID-19 has created a long-term economic and health crisis. During the 2 weeks that ended on March 28th, nearly 10 million people had applied for unemployment insurance, dwarfing any previous monthly numbers. During the outbreak, there were no commercially available medicinal treatment or vaccine for COVID-19 prevention, treatment, or control. The CDC and World Health Organization were hopeful that most infected persons with COVID-19 virus would experience mild to moderate respiratory disease and bounce back without requiring special treatment. However, elderly people, as well as those with underlying medical issues such as cardiovascular disease, diabetes, chronic respiration disease, and cancer, were likely to develop various illness. COVID-19 was and is believed to have a higher mortality rate than seasonal influenza, even though large variations are confirmed. This was also predicted by WHO that mortality will be around 0.6 in countries such as Korea. Vaccine development and medicinal treatment research for COVID-19 was still underway, but there were many unknown months away. During the pandemic, businesses could only survive a short time without customers. But sustained shutdown were becoming more and more painful. As time passes, relief checks were also being exhausted. Without access to credit, some retailers, maybe including medical officers, also shut down permanently. For example, travel bans and lockdowns in Africa interrupted distribution network exposed to inputs from Asia, Europe, and Middle East, as well as crashed demand in global market for a wide range of African export. Besides, Africa was likely to encounter delayed or reduced foreign direct investment as partners from other continents redirect capital locally. Thus, given the uncertainty of the virus and its catastrophic impacts, countries relied heavily on behavioral change and non-pharmaceutical interventions, including, among others, self-isolation of symptomatic individuals, increased hand hygiene, physical social distancing, working from home where possible, and school and business closure. Therefore, the current study seeks to find out the effect of COVID-19 pandemic on health system. Methodology. This research is descriptive. The study was based in Kenya context, targeting both public and private healthcare providers. The study was qualitative with a focus on key correspondents that are health practitioners in health facilities handling COVID-19. The study targeted all healthcare practitioners under Kenya Medical Practitioners and Dentists Council Doctors Retention Register. The sample size was 68. The respondents were randomly and conveniently selected to respond to the questions. The data was collected by use of an interview guide. Data collection was done by use of Google surveys, where emails were sent to the selected correspondents. These are sources of questions and sample of questions that we set out to the respondents to gather the desired data for analysis. The results. A total of 68 questionnaires were given out and 54 were properly filled and returned. This return saw 79.1% response rate, which is adequate. Result about receipt of allocation of finances to curb COVID-19. The result in the table above revealed that 88.89% of the correspondents agreed that their facilities had received the allocated finances to help curb COVID-19 from the Ministry of Health. For those who did not receive the funds, it was noted that they managed COVID-19 by other means, such as the adjustment, lean operation, and funding from donors and charities. And about the result of preparedness of the hospital to curb COVID-19, the finding revealed that 81.48%, 79.63%, 75.93%, 75.93%, and 68.52% indicated that the hospital had insufficient number of beds, number of ventilators, number of protective gears, number of swabs, and number of coronavirus test kits, respectively. The result about availability of hospital equipment to curb COVID-19 are as follows. The result indicates that 77.78%, 88.89%, 79.63%, 70.37%, and 83.3% indicate that the number of beds, numbers of ventilators, number of protective gear, number of swabs, and number of coronavirus test kits, respectively, were not accessible. The result about the extent to which access and adequacy of existing facilities had affected the COVID-19 patient. The result is as shown in the table, and it reveals that 72% of the healthcare practitioners indicated that the access and adequacy of existing facilities had affected COVID-19 patient to a greater extent, while 28% indicated that it affected COVID-19 patient to a small extent. The result about access and adequacy of existing facility to non-COVID-19 patients indicates that according to the table above, 83.33% of the healthcare practitioners indicated that access and adequacy of existing facilities had affected non-COVID-19 patients to a greater extent, while 16.6% indicated that it had affected non-COVID-19 patients to a small extent. And now the result about access and adequacy of existing facility to nurses and medical staff. According to the table above, the finding reveals that 86.04% of healthcare practitioners indicated that access and adequacy of existing facilities had affected nurses and medical staff to a greater extent, while 12.96% indicated that they had been affected to a small extent. And about access and adequacy of existing facilities to administration of the hospitals. The table below shows that 77.78% of healthcare practitioners indicated that access and adequacy of existing facilities had affected the administration of hospital to a great extent, while 22.22% indicated that the administration of the hospital had been affected to a smaller extent. And now the results about COVID-19 patient sustenance in the quarantine facilities. According to the table above, the finding revealed that 57.41% of healthcare participants indicated that the government had taken care of the costs, while 42.59% indicated the patients paid from their personal expenditure. The healthcare provider were asked to describe a typical working day at the COVID-19 isolation facility. The majority of them uh, indicated and stressed on the adherence of social practices and hygiene practices as directed by the Ministry of Health, such as social distancing, washing hands, and keeping hands clean, putting on masks, among others. One respondent indicated everything about hospital work day is about being alert. However, given COVID-19 pandemic, the healthcare operation are not normal. Our medical facilities are stretching to the limit and to sustain the rising number of new infection or reinfection proves even harder. For me, the healthcare is put to ultimate test of a lifetime. Another one added, and I quote, our hospital operation have really been put on alert, and now precautions and accuracies are very strict. However, everything about medication is from the primary healthcare to avoid our bed capacity to be exceeded. We encourage everyone, including the nurses and personnel, to adhere to the basic standards of COVID-19 prevention. The same resonated with a doctor who stated that, and I quote, I think we are in a temporary era where the medical department has seen a shift in the operation. A deadly disease in which is with us, and one thing we, as the soldiers of the healthcare department, work tirelessly to provide best medical care to our patient. It is clear that no one is 100% secure, but we are encouraged to maintain precautions. The healthcare providers were likewise asked to describe how the virus pandemic has affected the health system of the hospitals, and here are some of their response. One of the respondents indicated, and I quote, the virus at first was manageable, but upon the second wave of the virus, the healthcare has been significantly affected. For example, we are forced to scale up the bed capacity, but we have insufficient funding. As such, we are forced to charge extra on the patients who come in. Another one added, and I quote, our doctors and nurses really work long hours to to save life and save themselves as well. They are the one at the front line, and for them to be motivated, they need extra monetary compensation. Another one stated, on the positive side, the virus has enlightened us toward primary health care practices of prevention rather than treatment. However, the virus is robbing the healthcare system of its usual capacity to take care of patients. It means continuous preparation and provision of healthcare facilities to manage the disease, which at the end lead to constant financial requirement. Discussions. From the finding, the study concluded that COVID-19 has significantly affected the health system. In this regard, the healthcare facilities have received the allocated finances to help curb COVID-19 from the Ministry of Health. For those who did not receive the funds, it was noted that they managed COVID-19 by other means such as readjustment, lean operation, and funding from donors and charities. However, the hospitals have insufficient number of beds, number of ventilators, number of protective gears, number of swabs, and number of COVID-19 test kits to help manage the pandemic. Likewise, the study indicates that the number of beds, number of ventilators, number of protective gear, number of swabs, number of COVID-19 test kits, respectively, were not accessible. The study therefore concluded that the access and adequacy of existing facility has affected the COVID-19 patient, non-COVID-19 patient, nurses and medical staff, as well as administration of hospital to great extent. This concludes that the financing is still an issue to many COVID-19 patients, especially those who visit primary hospitals or clinics. The study concludes that COVID-19 is one among the external factors that have negatively influenced the performance of health care systems. Recommendations from the study. The study recommends that the county, in conjunction with the national government, to scale up measures to ensure that the allocation of funds and resources necessary to combat COVID-19 are made available and accessible to all hospitals in the country. The study recommends transparency and accountability measures by the Ministry of Health as well as related healthcare stakeholders on the funds allocated for the purpose of fighting COVID-19 pandemic. Likewise, the study recommends the Ministry of Health, the management of the hospitals, and related healthcare stakeholders to maintain the sensitization of the public on the need to ensure primary health practices are there too. Then the study also recommends the development of long-term disaster plan to give clear guidelines that keep the nation healthy, especially in low-income communities and vulnerable groups. Given the PESTEL model only include political, economic, social, technological, environmental, and legal factors, the study recommends extrapolation of the model by which include such factors as pandemic like COVID-19 in order to form the basis of policy contribution and practical applications. And thank you.